Good evening, YouTube. Morning, night, whatever time of day it may be, depending on where in the world you are. Today is Wednesday, March 11th, 2015. Been in Tampa now for about a week. Going through testing. I've had one surgery, MRIs, X-rays, VMAs, which is vertebral motion assessment. Preparing to get my second back surgery tomorrow. I'm scheduled to go in at 5:45 a.m. That'll be March 12th. I want to continue to talk about the Laser Spine Institute and just how impressed I've been with the level of customer service that they give and their complete commitment to serving the patient, as well as the care partner, your wife, husband, child, whatever the parent, whatever the case may be. And as I told you, I would give an unbiased review, and I'm going to tell you very honestly, I'm very highly impressed with the facility and the care that I've received. And I've been in other, you say, well, you're paying them a lot of money. And I am, that's true. I've dealt with other facilities, other hospitals, and paid just as much. I've spent a night in the emergency room to try to get some pain relief about 18 months ago at a facility. And what the result of that was absolutely zero care. I got a couple of shots of Dilaudid, and I think they charged me $1,200 a piece for those shots. CT scan that I did not need. They charged $8,000 for that. $5,000 of that I had to pay out of my own pocket because the insurance would not. The biggest majority of it, the insurance refused to pay because they said I didn't need it and had absolutely nothing to do with my injury, which I agree with, by the way. Fought the hospital on that to try to get that charge reversed, which they would not do. But I don't want to go into that, and that's not what this video is about. But I really want to tell you that I really had a positive experience with the Laser Spine Institute. Because of... I want to tell you, I came down here. I was scheduled for one surgery when I came down here 1 week ago. 1 week ago, and let me tell you something. And you guys know this. If you've been involved with your back injury at all for any length of time, you understand that 1 week is not that long at all. For example, I was trying to get an appointment with a neurosurgeon up close to where I'm from. The appointment that they gave me was over 8 weeks out. And I already know from past experience, they would have sent me for an MRI. I asked them just to go ahead and order the MRI ahead of time so that I could already have it to save an appointment, which they refused to do. Put it this way, and I'm just going to lay it all out for you. A neurosurgeon from making a decision, yes, I need a back surgery, to actually getting the surgery, I'm going to estimate it's going to take you a year, because you're going to have to get some blood drawn and have that analyzed, and they're testing for different things in that. That's probably 2 different facilities, 2 different bills, 2 different people to do that. Then you're going to have an MRI. That's going to be probably 2 different facilities, because one facility is going to take the MRI. Another facility is going to read it. All that stuff takes days and weeks combined to actually happen. And then you're going to have X-rays or at another facility yet. Probably, I don't know, I assume the VMAs, that's at a whole other facility. And with the Laser Spine Institute, and I don't know, there's other organizations that do laser spine surgery, And I don't know whether they do it the same or not. So I'm not saying that LSI is any better than any of the other laser spine surgery centers. There might be some that's better. I don't know. I don't have any experience with that, but I do have experience with neurosurgeons and conventional medicine. And when comparing to the treatment I've received there versus the costs that I've paid, there's just no comparison. I mean, there's just absolutely no comparison. As far as my neck, it's doing much better. I had the surgery Monday and today's Wednesday, so it's been basically about 2 full days, 2.5 days since the surgery. And I'm still calling it a success. There is still some soreness in the muscle. What they do is they kind of stretch the muscle a little bit. And I think I already talked about that. But in my lower back, I told you on the previous vlog, it's L5S1 disc. And here's what they did today. We went in there, we scheduled the surgery, we went through the insurance type stuff. Again, they told, this second surgery is not going to cost me anything. So I just really want to encourage you, if you need multiple stuff done on your spine, and you think whichever facility you choose, I would really try to time it to where you're doing everything as close together as possible. Because it just makes sense. It makes sense from a financial perspective, because once you have your deductible, and then you also have what's called a maximum out-of-pocket expense. In other words, depending on your insurance company, and you can call them and check all this, and it's definitely well worth your time to time it accordingly. I would not recommend, say, starting a process in November or December, because see, chances are you're going to cross past December 31st, the deadline, and then your deductible and your maximum out-of-pocket is going to start all over again. So you're going to basically have a clean slate, and you're going to have to meet that deductible again. I would really, no matter what kind of medical treatment you're having, if it's going to be if it's not an emergent, obviously if it's an emergency, then you got to do what you got to do. That's common sense. But if it's going to be a longer drawn out procedure, and there could be multiple treatments for it, and if it is such an injury that you are able to kind of schedule, then it's kind of a no-brainer to try to start that thing in January or February and give yourself as much time as you possibly can within the same year, within the same calendar year, because it could save you thousands of dollars. But I want to tell you something. The video is getting long, but what they done today, there was 2 different areas in my lower back. One that they thought was the problem area at L5S1, but they wanted to make sure that it was actually going to fix the problem when they did it. So here's what they did. They done sort of a little like a trial run, so to speak, and it's called it's 2 different names for it. It's called either a selective nerve root block or a diagnostic facet injection. What they do, they take an x-ray, they put you down on a table, and again, this is done in the same facility, okay? And it's all meshed together. Everybody knows what everybody else is doing. You don't have to sit there and explain the same thing over and over and over again. You show your insurance information and your ID. You do that one time. You're not going to 5 different facilities and going through this same process with 5 different people. You're not going to get a bill from 5 different people, like, some of you understand all that. So they send me downstairs. They put you in an x-ray. They put this x-ray thing on you. They find that problem area, in my case L5S1, and they inject it with a shot of lidocaine, a temporary local anesthetic, kind of similar to what you might get if they're doing a root canal or something on your tooth. Same principle, but here's what it does. They put it in the spot that they think is the offending area to see if that temporarily relieves the pain. Okay, the logic behind it is, if we're targeting the right area, the one that's causing you the most discomfort, this shot of lidocaine will make it temporarily quit hurting. And in my case, it did. It decreased the pain significantly. On the contrast, if they give you a shot in the area that they're preparing to do surgery and it does not have any effect on you, then the chances are that the surgery will not have any effect or much effect either. So, and I thought that was a very simple test, but yet very much ingenious that they did that. Again, I told them that I wanted the surgery yesterday, Tuesday. They're scheduling me for surgery Thursday, 2 days later. Now, try that at a neurosurgeon or at a conventional hospital, and I can promise you it's not going to happen. Okay, and the benefits of that is I've probably already shared. The recovery time, I'll be able to recover from both surgeries at the same time. Those can run concurrently, instead of recovering from one, getting another one, and then recovering from that one. And the cost of it, and also the time off and the trip down here. Something real brief, I want to try to keep this short. I wanted you to also get you to think about is, during your stay, you should maybe really try to think about the cost of living for the week, maybe week and a half you're going to be in the area, and kind of start to think about that. And maybe that might have been something I might have done a little bit differently. We're in Tampa, Florida during spring break. The motel rooms are extremely expensive. 150 to 200 bucks is, and if you can even find one, they're not that easy to find. And then also, when you do book a motel, if that's going to be your choice, maybe you should, the one we have has a good hot breakfast every day, and Monday through Thursday they have a good hot supper. So that's 2 meals a day for 2 people. So the cost of that is probably, I estimate, and it's a pretty good meal. The breakfast is pretty good and the supper is pretty good. It's been pretty good every night. And that's only Monday through Thursday, but I would encourage you to check, because that savings is probably worth about 50 to 60 bucks that it would have cost us if we would have had to go to the restaurant, maybe more. So just think about it, and kind of do a little bit of math ahead of time. Let's say you're looking at a room for $100 a night with no supper, no breakfast, compared to a room that's $150 a night that has supper and breakfast. Okay, the $150 room is actually the better bargain. Okay, and it's a nicer motel and it's a nicer room for basically this, the same amount or less money, actually, all things considered. So put on your thinking cap, do a little bit of homework when you're planning your surgery. Figure on being there a week. Minimum, depending, maybe longer, depending on your situation. I've heard of people having 3 or 4 of these done, back to back to back, pun intended. Okay, thank you for watching. Give me a like, subscribe if you're not already. Ask questions, and I'll do my best to answer them. Thank you very much. God bless you. Bye.